Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, How to Stay Heart Healthy, presented by Dr. Rohit Sehgal, cardiologist with Washington Township Medical Foundation. Dr. Sehgal is the Chief of Cardiology at Washington Hospital. He is board certified in internal medicine, cardiovascular disease, and interventional cardiology. Dr. Sehgal has been practicing clinical and interventional cardiology in the East and South Bay for over 20 years. And now, please welcome Dr. Sehgal.
Hello, everyone. Thank you for that really comprehensive introduction, Christy. It's a pleasure for me to be here today to talk about a subject close to my heart. I've treated heart disease most of my life, and it's been very exciting and fulfilling. Over the years, though, I've come to realize that the best form of cardiac, i.e. heart care, is actually prevention of heart disease. I'm hoping that at the end of today, I would have given you, at least in some measure, some strategies to keep you out of my office. I kind of want to be like the Maytag repairman in those old ads. Let's go over these things together. The heart, all of you know what the heart is, but just to recap, it's a muscular pump that keeps blood carrying oxygen and nutrients flowing through our body. It's working hard and working for us every second of the day. It needs its own blood supply and gets it from tiny arteries called coronary arteries that run on the surface of the heart. Here my little pointer will show you these red arteries here. These are called coronary arteries, and as we'll go over, this is kind of one of the most vulnerable spots in the heart. The heart can be afflicted by many conditions. The most common type of heart disease, and very often when we refer to heart disease, we're talking about coronary artery disease. So those little arteries I pointed out to you, those little blood vessels that run on the surface of the heart, they can sometimes get clogged. So you see how this is a normal artery flowing, and this yellowish creamy material here is plaque building up on the lining of the artery. This clogging or plaque buildup in the arteries of the heart is what we call coronary artery disease, and it's the most common cause of death in the world. Coronary artery disease causes heart attacks, damage to the heart, heart weakness, a condition called congestive heart failure, and overall, it's the leading cause of death. There are other causes of heart disease as well. Uncontrolled high blood pressure can cause the heart to get weak or sometimes very stiff, again causing congestive heart failure. Excessive alcohol intake can cause a heart muscle weakness called an alcoholic cardiomyopathy. Alcohol or high blood pressure, and sometimes just occurring out of the blue, can cause a condition called atrial fibrillation, which is a condition of irregular heart rhythms. Let's go over coronary artery disease, because this is probably the leading cause of heart disease in the world. We still don't know the exact mechanisms of causation of coronary disease. And that sounds amazing because, we've come so far, we have so much research, but we still don't really know what exactly causes coronary disease. We do know a lot of risk factors though. And I've got some of them up here on the slide. High LDL cholesterol, that means the bad cholesterol. So the bad cholesterol is high, that increases your risk of heart disease. Some people have low HDL cholesterol. And what that means is that their good cholesterol levels are low. The good cholesterol is like a garbage truck which pulls out plaque from the arteries of the heart and takes it to the liver to be processed. So people who have low levels of good cholesterol also have an increased risk of coronary artery disease. High blood pressure is another risk factor. Smoking, being overweight or obese is another risk factor. Physical inactivity also increases the risk of heart disease. And a family history of early heart disease is a really strong risk factor as well. Just for completion and to be comprehensive and to give you the full picture, I'm just going to spend a couple minutes on treating coronary artery disease. And there's a variety of treatments, including medications, coronary stents, which is like a little tube-like device that we place in the arteries. Coronary bypass surgery is another technique for treatment. But, overall, we want to focus on prevention. Prevention is much, much, much better than cure in this condition. And again, some of the things we'll go over, I've just mentioned here: exercise, a healthy diet, maintaining your weight, controlling blood pressure and cholesterol, and limiting alcohol. These are some of the strategies that we'll focus on in more detail. I love exercise. I wish I could do more of it. My crazy schedule sometimes, holds me back. But I think exercise is one of the paramount things that can help to keep you heart healthy. It's simple, it's free, it's de-stressing, and fairly accessible to most of us. How does exercise work? Why is exercise so good for us? Well, there's a lot of science behind the promotion of exercise as a heart healthy habit. For one, exercise causes the inner lining of the blood vessels, what we call the endothelium, to release a dilating substance called nitric oxide, which keeps the blood vessels open. So that tends to lower the blood pressure. Physical exercise, regular exercise, raises the levels of what we call HDL cholesterol or good cholesterol. In fact, it's the only proven strategy so far that we have to raise the good cholesterol. Exercise also makes the heart muscle stronger, makes it more efficient. People who exercise regularly have a lower resting heart rate because the heart is functioning so much more efficiently, it doesn't need to beat as much. Exercise brings the blood pressure down. And overall, the benefits are so solid that people who've had heart attacks and have been followed for their survival after that, it's been found that those who participate in a formal exercise program, what we call in the business cardiac rehab program, actually have a 25% lower mortality or death rate over the coming years. And again, there's a training effect on the heart, a lowering of blood pressure. People who have clogged arteries will have collaterals that build up, meaning increased flow. Their weights will come down. So all of these things lead to actually a 25% mortality reduction by exercise. I mean, that sounds great. A little caveat here: do not do this at home, so to speak, meaning that if you've had a heart attack, don't just suddenly start exercising. Talk to your cardiologist or your physician and have them make out an exercise program based on your abilities and based on what your heart can tolerate at this time. Again, what do we mean by exercise, or how much exercise is good? So the American Heart Association says that typically about 2.5 hours of exercise a week, sort of cumulatively. And usually what's been found to be beneficial in most studies and has been recommended is about 30 minutes of moderate intensity exercise, such as brisk walking, biking, swimming, doing a treadmill, about 5 to 7 days a week. This photograph here is actually our beautiful Lake Elizabeth in Fremont. And my favorite form of exercise is doing one lap around the lake with a brisk walk, which usually is about 2.5 miles or so, and takes me about half an hour to 45 minutes and gets me my exercise quota. And it's also very de-stressing and relaxing thing to do. Let's talk about diet. Eating a healthy diet is crucial. You've heard about the Mediterranean diet, the DASH diet. Those are all diet programs that are heart healthy and basically focus on fruits, vegetables, whole grains, lean proteins, lean meats, healthy fats. What we mean by healthy fats are like nuts, vegetable oils, fat from fish. Diet should also be rich in fiber. All of these things help because a healthy diet brings down your cholesterol. It reduces the risk of obesity and diabetes, keeps your weight under control. So all of these are all benefits of a healthy diet. Maintain a healthy weight. Being overweight or obese increases your risk of heart disease. It increases your risk of diabetes, which in turn causes heart disease. Being overweight increases your risk for high blood pressure, which weakens and stiffens the heart and also increases the risk for coronary artery disease. So it's a vicious cycle. So it's really crucial to maintain a healthy weight. Don't smoke or use tobacco products. Smoking is clearly a risk factor for heart disease, increases the risk for high blood pressure as well, increases the risk for coronary artery disease, and this is true even of vaping or the electronic cigarettes and so on. So I would say definitely avoid tobacco and smoking. Stress is really a definite risk factor, and it's kind of a risk factor that's been hard to quantitate. Stress is a very subjective thing. Stress is very much in the eyes of the beholder. Different mechanisms have been shown to cause the harmful effects of stress, or different mechanisms have been studied to show how stress can adversely affect the heart. Under stressful situations, chemicals are released that cause the blood vessels to constrict. Studies have shown that the blood platelet elements will clump together as an effect of stress hormones in the body. These clumped platelets in the blood can cause areas of plaque to start forming clots and can cause the risk of heart attacks. Stress is such a potent factor that even patients with no coronary artery disease, clean coronaries, have been found to have a heart attack type syndrome that mimics a heart attack. It's called stress cardiomyopathy, It's also called the broken heart syndrome because it occurs in individuals going through a lot of emotional stress, job loss, a death in the family, a divorce, major stressing life events can trigger off this broken heart syndrome. Interestingly, it was first described in Japan, and it's called Takotsubo's cardiomyopathy because the heart balloons out and it's shaped like an octopus trap. So it's an interesting phenomena. It's considered to occur by stress chemicals in the body causing the blood vessels to clamp down and constrict and decrease the blood flow temporarily. Fortunately, it's a condition that responds well to medications, and the survival with that is fairly good. Let me go on to stress reduction because we talk about stress being bad. How do we cut down stress? Physical exercise, again, our best thing. Physical exercise is great as a stress buster. Meditation, it sounds sort of old-fashioned, but it's actually a great technique for cutting down stress. Socializing with friends. I was going to say socializing with family, but some people get more stressed with the family, so it's kind of a mixed thing. Playing with pets. And I just had to put a little photograph of my Boston Terrier Pepper up on the screen. He's my stress buster, and he's right there in his winter jacket, actually, posing for this photograph. Thanks, Pepper. Alcohol consumption. Alcohol, in small amounts is actually a good de-stressing thing for most individuals. The studies that actually showed a benefit for alcohol in heart disease have been sort of found to be biased. They were promoted by some of the wineries, actually. They were funded by some winemakers, and the old adage of the red wine being heart healthy has fallen into some scientific dispute. But it does appear that a small amount of alcohol is not really harmful. Drinking too much alcohol, though, clearly causes heart disease. It can raise your blood pressure, increase your weight, increase your risk of irregular heart rhythms, increase your risk of diabetes. So overall does increase your risk of heart disease. What we would recommend is 1 to 2 drinks a day being the maximum in terms of avoiding damage to the heart. Getting enough sleep. Chronic sleep deprivation, and there have been studies where they found that if you sleep less than 5 hours a day, there is increased risk of high blood pressure, increased risk of coronary artery disease. So the optimal sleep hours have been found to be sort of in the range of 6 to 8 hours a day. Let's go over some of the big three, so to speak. So the big three modifiable risk factors are high blood pressure, cholesterol, and elevated blood sugar. These are the big three risk factors for heart disease. And I mention this specifically is because the only way you can control these risk factors is to measure them periodically. So, the old adage, knowledge is power. So I mention this as a point that it's really important to monitor these things. There are different guidelines from the American Public Health Association, from the CDC, from the American Heart, about the frequency of testing. But in most of us, particularly people over the age of 40 who have some degree of a family history, live an urban lifestyle, which is fairly rich in stress, a good rule of thumb is that you should have your blood pressure, cholesterol, and fasting blood sugar checked at least once a year. So in a healthy average over 40-year-old, you should get these things checked once a year: blood pressure, cholesterol, and a fasting blood sugar. Now, for people between 18 and 40, if they don't have a huge, strong family history and are not majorly overweight or have other major risk factors, you can probably get it done about every 2 years or so. The blood sugar check we talked about, fasting blood sugar, that's a way to screen for diabetes. We do another measurement of something called a hemoglobin A1C, which is a molecule in the blood that is kind of like a measure of how your blood sugars have been for the last 3 months. Amazing, isn't it? Science is great. We have all these nifty ways of checking things. The fasting blood sugar or a hemoglobin A1C, these are measures of or techniques of screening for diabetes. A fasting sugar greater than 120, a hemoglobin A1C level of 6.5% or above, a random sugar of 200 or greater are all measures or make the diagnosis of diabetes. Let's hone down on cholesterol. It's probably the single biggest risk factor. It's famous. All of you know all of you know about the cholesterol. It's a waxy lipid or a fat carried in the blood. It's carried in the form of what we call a lipoprotein, which is a protein fat complex that carries this in the blood. The LDL cholesterol is called the bad cholesterol, and there are studies. Here's a slide from a trial which was published in the 80s called the Mr. Fit trial, where it shows clearly a correlation of cholesterol and heart disease mortality. So as the cholesterol increases on this axis, the risk of death from heart disease increased in this axis. This was a big population study with many thousand patients, actually hundreds of thousands of patients. Their data was analyzed, and they clearly found that in these population studies, as the cholesterol numbers increased, the risk of heart disease or coronary artery disease death increased. So the LDL cholesterol, numerous studies have shown that as the bad cholesterol levels increase, your risk of a heart attack, your risk of dying from a heart attack keeps increasing. So how do we reduce that LDL cholesterol? One big approach is diet, and we've talked about it before. There is a diet program called the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. It's an eating plan that was developed by the National Heart, Lung, Blood Institute. And this lowers the blood pressure, it lowers the bad cholesterol, and reduces the risk of heart disease. Another diet plan is called the Mediterranean diet. And these diets basically emphasize vegetable, fruits, fiber, whole grains, low-fat dairy products, good fats, so to speak, which are unsaturated fats like vegetable oils, the fat from nuts, fish. We recommend limiting sugar, sweetened beverages, sweets, because all of these can increase the calorie intake, increase the risk of diabetes, and overall increase the risk of heart disease. Now, in many individuals, because the increased levels of cholesterol are not just about their food. Most people who have elevated cholesterol, there's a large component of a metabolic issue related to their genetics and how their body processes cholesterol. So unfortunately, even though they do exercise, they'll watch their diet, they'll still need medications to reduce cholesterol, specifically to bring down the bad cholesterol or LDL cholesterol. And the most well-known of these medications are called statins. In the old days, you all heard of Lipitor. That was one of the seminal sort of the prototypical statins. It's a drug called atorvastatin. Most of the statin drugs are now on a generic mode, and so they are easily available, and they are still the mainstay of medication therapy to reduce the cholesterol levels or reduce the LDL cholesterol levels. Statins have been clearly shown to reduce the risk of death and heart attacks in many, many different population groups. These studies were done in the 70s and 80s, and there were studies done on what we call primary prevention, where they just took people who've never had heart attacks but had elevated levels of cholesterol, and they put half of these people on a statin, the other half on a placebo, meaning a dummy pill. And it was ethical in those days because people had not found that statins would help. So they put people on those, and they found that statins reduced the risk of death and first-time heart events. Secondary prevention was also found to be good, that people who'd had known heart disease, statins reduced the risk of recurrent heart attacks or death. Side effects from statins are relatively low, even though people are scared of those, but scared of side effects, but by and large, side effects are pretty rare. Who should be on a statin? If your LDL cholesterol is really high, if your 10-year risk of coronary events is 7.5% or greater. Now, this is for the population of people who have mild to moderate cholesterol elevation. The question comes up, should they be on a statin or not? So the American Heart Association, based on a lot of population and epidemiological studies like the Framingham Heart Study and so on, have developed a online risk calculator which factors in other risk factors like blood pressure values, smoking history, your good cholesterol levels, bad cholesterol levels, and it puts them together and gives you a percent risk of having a heart event over the next 10 years. So the higher your risk is, the more your need to be on a statin is. So somebody who has a mildly elevated cholesterol level, if his 10-year risk is high, should be on a statin, whereas a second person with the same cholesterol level, but if his risk calculator score is less, may not need to be on a statin. People who are diabetic should be on statins. People who have established coronary artery disease, meaning who've had heart attacks, who've got vascular disease, which is basically the same plaque buildup but in other areas of circulation, people who've had strokes, they should all be on statins. A new novel risk determinant, because even the risk calculator was not sometimes found to have a full expression of risk. So a new determinant is called a coronary calcium score. This is a relatively simple, non-invasive, specialized X-ray test that measures the amount of calcium in the arteries. The level of calcium correlates with how much plaque you have and how complex that plaque is. And studies have clearly shown that an increased calcium score is an increased risk of coronary disease and heart attacks. So you can see on this little cartoon here, this is a normal artery. As you build up plaque in the arteries, and as the plaque becomes more and more complex, you can start to see these little white specks here, this is the calcium in the arteries. As this calcium increases, it's also a sign that the plaque is becoming increasingly complex and is more prone to what we call plaque rupture, which is often a trigger event for a heart attack. So as your calcium score increases, your risk of heart attacks increase, and hence, and here's the slide showing the increasing calcium score on one axis and the increasing risk of coronary disease on the other axis. So as your calcium score increases, your risk of heart events increase. So a elevated calcium score, even in the absence of a elevated cholesterol level, is an indicator to be on a statin. And one of the reasons that we say this is that the statins seem to have an effect beyond just the lowering of cholesterol. More and more studies are showing a direct, kind of like an anti-inflammatory effect on the blood vessels from statins. And that's why they are recommended even acutely for everybody who's had a heart attack or stroke and so on. So, having gone over all of this, let's recap for a second. I want to give you a couple of simple takeaway points. Let's keep it really simple. If one wants to be heart healthy, keep a healthy heart. The big things are exercise. Remember, half an hour a day, 5 to 7 days a week. Get off that couch, put down that TV remote, get on your feet. It's cold, it's wet, it's raining. Push yourself, exercise. Diet. Avoid those potato chips. Grab a bag of carrots instead of the potato chips. More fiber. Lean meats. Avoid rich dairy products. So diet. Watch your weight. Don't smoke. Don't drink more than 1 to 2 drinks a day. Check your blood pressure, cholesterol, and sugar at least once a year. These are the simple bullet points, and this is going to cut down my office practice substantially, but heck, if it helps guys and the ladies out there, that is all I need. So thank you for your time, and thanks for being there. I'm doing this on kind of on a Zoom or a digital format for the first time, so it's kind of eerie. But thanks for being a good Zoom audience or Facebook audience.
Great, thank you, Dr. Sehgal. We hope to get you in front of a live audience within the next year. So we do have some questions though for you.
Sure.
Who would be a candidate for a coronary calcium score test?
So a coronary calcium score test would be useful for somebody who doesn't automatically fall in the categories of statin use. So, I mean, that's the most prudent and cost-effective use of, of this kind of technology. Somebody who has established coronary disease, it's not really helpful because we know that they need meds for coronary disease. We know that they need to have periodic stress tests. We know that they need moderate or high dose statins. People who are very, very low risk may not need it or may not benefit as much. It's mainly the intermediate risk, middle-aged person with a cholesterol level of 110 to 120, 130, who has somewhat of a family history, somewhat of some of our risk algorithms or calculators don't always factor in the family history as strongly as they should, so the calcium score becomes useful there.
Okay, thank you. And then the next question we have is, do younger, physically fit women need to worry about heart disease?
Absolutely. I think everybody at all ages, have to worry about heart disease. Being a younger woman does not make you immune to heart disease. So I think all of these measures, all of these things should be followed there as well.
Right, and then our last question. I have a history of heart disease in my family. What age should my doctor order cholesterol tests?
If you have a history of heart disease in your family, I think at least once every 2 years or so, starting from age 18, you should have a cholesterol level done.
Okay. Thank you very much. This does conclude our program, and thank you, Dr. Sehgal, for answering all our questions and keeping us heart healthy. We're going to try to stay out of your office and see you walking around the lake. And thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.